Now, as the world commemorates World AIDS Day, the South African National Blood Service has encouraged people to keep testing for HIV and AIDS. It says that South Africa still has the highest number of people living with HIV in the world. However, over the last few years, the country has been making great strides in combating the virus. The SANBS has encouraged people to continue donating blood as they have testing technology that detects HIV. To unpack the critical work that the SANBS does to ensure that it supplies safe blood, we're now joined by Dr. Solomuzi Ngcobo, who's the lead consultant and medical affairs at the SANBS. Dr. Ngcobo, thank you very much indeed for joining us. Welcome to the program.
Good evening, Peter Ndoro and your viewers.
So, World AIDS Day, how important is that to the South African National Blood Service?
As you would know, World AIDS Day, which we have been commemorating since the 1st of December 1998, is about encouraging people to test. It's about encouraging people to know their status. It is encouraging people to be generally healthy, and also it is about remembering those who have fallen to this AIDS pandemic. And as South African National Blood Service, we also very much encourage the promotion of health. So we are very much encouraging the fact that people should test. We encourage that people should know their status. And that is why we are also very much in support of the World AIDS Day.
All right. And it's not just for the individuals, is it? Because it's important that donors know their status so that you can have safe blood.
Exactly. It is in the interest of South African National Blood Service that the population in South Africa is generally healthy. Hence, again, we promote the healthy living among the South African population. When people come to our clinics to donate blood, one of the things that we subject them to is about health education, is about health promotion.
I remember tennis legend Arthur Ashe died after getting a blood transfusion, and he received blood that was tainted with the virus. How do you make sure in 2021 that we're not getting unsafe blood? Take us through your testing and screening process.
I must just mention that the South African National Blood Service, we rank among the best in terms of our blood safety. And it is amazing considering the high HIV prevalence that we have in our country. In terms of ensuring that our blood is safe, it does not only start with the testing. It starts way before that, when we go to the communities, when we recruit the donors to come to our clinics to donate. At the sites where we are recruiting, be it in school, be it in factories, or be it in our fixed sites and mobile sites, we subject our potential donors to extensive health education and health promotion. We subject them to, we educate them on the healthy ways of living. We educate them on living sexually safe lifestyle so that they don't get diseases such as STIs as well as HIV. So way before that, we educate them, and we tell them about the risk that someone, for instance, who is sexually irresponsible may pose to the blood safety. And as such, some of these donors would self-exclude at the recruitment process, even before they get to our clinics. And then when they get into our clinics, we again subject them to health education and promotion in terms of living, for instance, a sexually safe lifestyle, like not having multiple sexual partners, for example. On top of that, again, they have to complete a questionnaire. The questionnaire, the first part, will be asking them about the general conditions, have they been admitted to hospital, what chronic conditions do they have, be it diabetes or hypertension. And then the last part specifically asks them about their sexual behavior. For instance, we'll be asking them about whether they have more than one sexual partner, or whether they think they're HIV positive. And if at that point we are able to detect that this person is not living a sexually safe lifestyle, we are then able to exclude that person, that potential donor. And also the potential donor by answering yes to certain questions. For instance, if the donor says, I have more than one sexual partner, I do transaction for sex, we will then exclude that potential donor because she is posing a risk to the blood safety. Having done that, having taken care of those, excluding those who are at risk, we'll then bleed the patient, we'll then procure the blood from the patient, and then the blood is tested by the state-of-the-art test that we do in South Africa, which is called nucleic acid amplification test. We are one of the few countries in Africa, the other one being Namibia, where each and every unit is subjected to the NAT, we call it a NAT test, nucleic acid amplification test, wherein this test amplifies the viral particles. It is able to look at the DNA or RNA, and as a result of this test, we have been able to reduce the window period drastically. For instance, for HIV, it's about 4 days. Wow. So that is how we ensure the safety of our blood supply.
COVID-19 has been a major disruptor. How has that affected the work of the SANBS and also the rate of donations?
It certainly has affected the blood supply at South African National Blood Service. And as you would know, the blood supply plus is an equation of how much of blood we get, that is the blood supply, and also how much of the demand, how the doctors are using blood. And COVID-19 has affected us in that way. In terms of the blood supply, we are not able to go to the usual sites that we would have been going to. For instance, we are restricted in terms of the factories that we could go to because some other factories do not allow some people from outside to come to their places. And also due to COVID, a lot of people have been working from home. So as a result, even if we were to go to the factories, there would be no one there. And in KZN, for instance, one of our big sites in terms of getting blood at the universities and the school. And as you would know, a lot of students were starting from home, and that also affected us in terms of getting blood either from the school or from the university. This COVID has really affected the blood supply at South African National Blood Service.
All right. So what do we need to do to, get more donors to come forward and for them to feel safe, I guess, doing the process? What can you do to reassure them?
We, even at the height of pandemic, even during the hard lockdowns, we have been able to get into contact with our donors to tell them that it is safe to come to our donor clinics, and all the COVID-19 protocols were being observed. So, and a lot of altruistic donors were even able to come even during the hard lockdowns, because we are ensuring that COVID protocols are even observed even at our clinics. But some of the strategies that will then starting to be going to where the donors are, whether they are in some estates, we go to their neighborhoods, even if it means going to the churches or even going to the garages. Those are some of the strategies that have been brought about by this COVID.
So what's your big message then on World AIDS Day as the South African National Blood Service to the population?
We support the World AIDS Day as the South African National Blood Service. We support health promotion. We also support the fact that World Day is about people becoming more aware of HIV/AIDS. We support the fact that people should know their status because, as I did mention earlier on, a healthy population is in the interest of the South African Blood Service because it's mostly healthy donors who are able to donate blood for us.
Dr. Ngcobo, we'll leave it there. Thank you very, very much indeed, and keep up the good work that the SANBS is doing. And it's heartwarming to know that we have one of the highest safety standards in the world, given the prevalence of HIV in our country. Thank you so much.
Thank you, Peter Ndoro.